Deypalan from Basin 2 Wiedenbach, and today I will be performing tepid or cold Spanish bath. It is the application of cold water to the surface of the skin by means of a wet sponge. Prepare the water to a temperature of about 29.5 degrees Celsius or 85 degrees Fahrenheit, but add ice chips to bring the temperature down while bathing the patients until the water temperature reaches about 18 degrees Celsius or 64.4 degrees Fahrenheit. Prepare the client to gain cooperation. Explain that the face, neck, arms, legs, and back will be sponged and that the procedure takes about 25 to 30 minutes. Protect the patient's bed with moisture-proof material to protect the linens from getting wet. Remove the gown and assist the client to a comfortable supine position. Removing the gown provides access to all skin surfaces. Cover the patient properly to prevent shivering as various parts of the body are exposed to bathing. This is for prevention of chilling, minimal exposure, and provision of privacy. Place bath towel under the head to protect the bed sheet from getting wet. Prepare several ice bags. Once ice bag is placed on the patient's head to promote comfort, others are placed in the axillary areas and in the groin where the blood vessels are close to skin surface. The ice bag helps to cool the patient further. The axilla and groins contain large superficial blood vessels that aid the transfer of heat. The application of the ice bag promotes cooler temperature of the body's core by conduction. Immerse folded washcloths or material for sponging in basin with water. Sponge the client's face with plain water, pat to dry, then sponge the neck. Sponging of the face and neck should be within 3 to 5 minutes. Frictional rubbing may raise body temperature. Sponge the arms and legs. Place a bath towel under one arm and sponge the arm slowly and gently for about 3 to 5 minutes or as tolerated by the client. The farther arm should be the first to be sponged. Slow, gentle motions are indicated because firm rubbing motions increase tissue metabolism and heat production. Cool sponges given rapidly or for a short period of time tend to increase the body's heat production mechanisms by causing shivering. Cover but do not dry each part as it is sponged. Evaporation of moisture on the skin helps to reduce body temperature. An excessively heavy covering may increase body temperature. Do the same thing in the lower extremities. Hold the washcloth briefly over the wrists and ankles. The blood circulation is close to the skin surface in the wrist and ankles. Change water PRN. Water temperature rises as a result of exposure to the patient's warm body surface. Check the patient's skin color and pulse rate during the bath. If the patient becomes pale or cyanotic, or if the pulse rate increases or becomes irregular, discontinue the bath, because this indicates that the temperature of the patient may have dropped to subnormal level. Do aftercare of equipment and change bed linens if soiled to avoid transmission of infection. Address the patient. Check the patient's body temperature about 30 minutes after the bath. This is to evaluate the effectiveness of the sponge bath. Document assessment, including the temperature rechecks. Drop temperature is recorded, graph according to agency policy. Recording communicates that the care provided in an accurate and firmly fashion.